Hello. Right. So in recent weeks we've been looking at the shoulder, and we've been talking about, so I did a series of videos where we looked at the big muscles of the shoulder, and then we went to the deeper, smaller muscles of the shoulder, and then we looked at the bones of the shoulder, kind of all linked up a little bit. How about we do the same thing with the hip, all right? Because the hip is similar. It's the other, like that one, but down there. So today, let's talk about the big muscles of the hip. So there's a video where we talked about the knee, talked about the muscles of the knee, the big muscles of the knee, right? Do you remember that video there? So in that video, we talk about the same, well, some of the same big muscles. We talk about some muscles which move the knee, some of those muscles also across the hip, and we'll talk about those again today. But go and have a look at that video if you want to be reminded. There's also another video where I talk about the movements of the hip joint and when you're walking, which is me wandering along talking about movements of the hip joint and how they relate to gait. But today then, if we talk about the muscles, the big muscles of the hip, can you hear the seagulls? It's a sunny day here in Swansea. Seagulls are happy about something. So if we talk about the big muscles of the hip, we can look at them in groups. So we should talk about the movements of the hip joint and then talk about muscles in groups that move the hip joint. Remember, I'm going to focus on the big ones. Mention their nervous innervation because that's important when things go wrong. Okay, so you've got two hips. Movements then, right. Okay, so movements of the hip. This is extension of the hip. I'm extending my hip. I can't extend it very far. Whereas this is flexion of the hip. I'm quite good at flexing my hip. I can flex my hip quite a long way. And then we also have abduction of the hip, which is surprisingly important. Adduction of the hip. And then of course we've got, if I flex my knee, we've also got, it's difficult to see in black trousers, isn't it? Black trousers are probably a bad idea for today. But we've got medial rotation, so it's the femur that's rotating, right? So medial rotation, lateral rotation, medial rotation, lateral rotation, flexion, extension, abduction, adduction, and if we join all these movements up, we can do circumduction of the hip. Here's an interesting point, and we'll talk about this more when we look at the bones and the ligaments, but when I extend my hip joint, it's now quite difficult to rotate my femur. But if I flex my hip joint, it's now very easy to rotate my femur. How about you try that right now, see if it's the same for you. The reason that occurs is because the ligaments holding the femur into the hip joint, which we'll look at in a moment, they have the ligaments have a little bit of a spiral to them, and when you extend your hip, that spiral tightens up, pulls the joint tightly together, and when you flex your hip, that spiral unwinds a little bit, so it becomes less tightly wound, so you can move it a bit more. Funky, huh? This is a left femur. Here's the pelvis. I think it's fair to say these are on two slightly different scales, but essentially they go together like this, right? And what we have here is, this is the head of the femur, and the head of the femur, this is the ball of the ball and socket joint, goes into the socket here, and the socket, this is the acetabulum, and like in the shoulder, there's a labrum around here of kind of rubbery connective tissue that extends it a little bit. But you can see how this is much more of a closed socket than we have in the shoulder, the glenoid fossa, right? It's a nice deep socket. So we have this this ball and socket joint. So it's pretty tough. But like I say, we'll look at the bones and the parts of the bones and the ligaments in more detail in another video. But suffice to say, at this stage we've got a pretty tough ball and socket joint, and that's what's giving us those movements. We should probably mention some features on the pelvis and on the femur. So when we talk about what muscles attach to, you know what I'm talking about, right? So there are some pretty big features. So if this is the head of the femur, this is the neck of the femur, and if we turn this posteriorly, do you see this massive great big lump here? This massive great big lump is the greater trochanter. This little lump here is the lesser trochanter, because we're going to have a greater and lesser, right? Greater trochanter. And the femur actually is at an angle in our lower limb. It's not so much like this. We have some interesting forces acting on it, like the shoulder. Let's start with the hip flexors. All right, now the hip flexors, the flexing the knee, flexing the hip, raising the knee. We find some hip flexors here. So this is the ilium, this is the iliac crest here, this is the anterior superior iliac spine here, here's the pubis, this ligament here is the inguinal ligament, and we can see there's actually two muscles here, there's certainly one muscle in most people, psoas major, psoas, P-S-O-A-S. Psoas major is a big muscle coming from the lumbar vertebrae, and it's inserting into that lesser trochanter on the femur, deep in there, right? Now, from the wing of the ilium we can see iliacus, another muscle. And iliacus and psoas major tend to come together to form iliopsoas. They both insert into the lesser trochanter of the femur, and when they contract, they raise the femur. So these are the main hip flexors. And they're deep and large muscles. Where's psoas minor, you ask? Well, psoas minor tends to be on the anterior surface of psoas major. It's a much thinner, smaller muscle. Sometimes difficult to distinguish from psoas major. So those are the hip flexors, but when we looked at the knee, we looked at the quadriceps, and we saw that the quadriceps muscles are the big extensors of the knee, so they straighten out the knee joint, and it's a really big muscle group, and it has four parts. Quadriceps meaning literally four heads. This part here is rectus femoris, femoris of the thigh, rectus straight, and this muscle, it crosses the knee, we can see here, going across the patella and into the tibia, but it's also crossing the hip. So rectus femoris is also a hip flexor. Psoas major and iliacus are innervated by little nerves that come out of the lumbosacral plexus. They don't go very far, they haven't got very interesting names. Quadriceps femoris is innervated by the femoral nerve, which we can see here. I'm going down there, right? While we're here, this is Sartorius. Sartorius is supposedly named after the tailor's muscle. When these were named, however many years ago, tailors were considered to sit cross-legged. And the Sartorius muscle passing across, look, see where it runs from here across to here. It also helps flex the hip and laterally rotate the femur, bringing you into a cross-leg position. Honest. There's Sartorius, And there are some deeper muscles in there. I'm going to save those for the deeper week. So this is the anterior compartment, innervated by the femoral nerve. So those are the hip flexors. So what about hip extension, where you're extending the hip out, the femur out behind you? Well, when we looked at the knee, we also looked at the hamstrings. So as you walk, you can, if you palpate your hamstring muscles and walk around the room, walk up and down, you'll feel your hamstring muscles contract as you push your foot behind you and you step over your foot. So these guys, these big long muscles, let's take this muscle off, they're running from the ischial tuberosity here which is another big attachment site. From the ischial tuberosity down here, we've got biceps femoris is lateral. Look, here's the little toe. Biceps femoris is lateral. Biceps means it has two heads, femoris of the thigh. It has a long head up here and a short head. Deep to that, coming from the femur. And then we have two muscles medially. We have semitendinosus, that's a little bit more like a tendon down here, and semimembranosus, which is deep to it. So these two muscles lay on top of each other, and semimembranosus is more membrane-like. And these again go from the ischial tuberosity, and if we have the fibula here laterally in the head of the fibula, they're going down to the tibia medially. Oh, you can see that there, right? More about those in the knee video, because these are also flexors of the knee. This is the posterior compartment of the thigh. So the muscles here are innervated by the sciatic nerve, which you can see, right? Sciatic nerve. Huge, great big nerve, innervating the posterior compartment and everything distal to the knee. And you can see lots of smaller muscles here as well, which we're not going to talk about today. We'll talk about probably next time. The muscle I took off, this is big muscle, big powerful muscle in humans, particularly important in humans, and this is Gluteus Maximus. It has a very distinct shape. It can become very large because it's a very powerful muscle, and this is a powerful extensor of the hip. And we need a powerful extensor of the hip. In fact, all of these muscles are large because they take our entire body weight. This muscle is particularly important when you stand up out of a chair. So if you're sat down, as you stand up, you're contracting your quadriceps muscles to extend the knee, and you're extending the hip. When you're sat down, the knee is bent and the hips are bent. You stand up. So you're contracting the hamstrings across the hip joint and gluteus maximus across the hip joint. If you have weaknesses in these muscles, you won't be able to sit up out of a chair unaided. You'll need to use your arms to lift yourself. Gluteus maximus is also important when you're going upstairs then, running, sprinting, jumping. It's a real powerhouse. It's very important when we're standing upright as well. I mean, it's not like you've got permanent tone in your gluteus maximus, but us being very upright, bipedal animals, walking long distances and all those sorts of things, means that gluteus maximus is more important to us than maybe to others. Gluteus maximus is innervated by the inferior gluteal nerve, which is a branch of the lumbosacral plexus. So the inferior gluteal nerve here. Okay, so those are the extensors of the hip joint. What about abduction and adduction? Right, well, if we're here, let's take off gluteus maximus. Now, if we have a maximus muscle, there's got to be at least one other muscle. And we find we've got gluteus medius and minimus. Now, gluteus medius is here, gluteus minimus is deep to it. Gluteus medius and minimus are both running, look, from the iliac crest here and the ilium, and they're running to the greater trochanter, right? So that's that big knobbly lump on the femur that sticks out laterally, and you can palpate this on yourself. This knobbly bit out here is the greater trochanter, and if we have a big knobbly bit on a bone, that means there's lots of muscle fibers attaching there. And again, we're talking about supporting our entire weight, right? So powerful, strong, large muscles. Gluteus medius and minimus then are running out to the greater trochanter of the femur. These muscles are important because they abduct the femur at the hip. But why is abduction so important, you say? You're not always sticking your leg out sideways, are you? When you walk, with every step you take, you're standing on one foot for part of the gait cycle. And for that movement to be efficient, the pelvis needs to stay level, right? So for the pelvis to stay level, gluteus medius and minimus contract and keep the pelvis level, right? So they're not actually abducting in terms of pulling the leg away from the midline. They're abducting in terms of holding their tone and keeping the pelvis and the femur in line. So gluteus medius and minimus are very important. They're innervated by the superior gluteal nerve. Now, if the superior gluteal nerve is damaged, you will notice some significant changes to gait. As the person walks, the pelvis will drop on one side, and if the left side is weak, then the pelvis will drop to the right side, right? Does that make sense? Because the muscles on the left won't be able to hold the pelvis up, right? So the hip will drop on the opposite side to the weakness. This gets called Trendelenburg's gait. It gets called hip drop, foot drop. You may see a foot dragging gait, because if the pelvis drops, then it's harder to lift the foot through, so the foot often drags on the floor. The person might adapt by swinging the foot through, all sorts of things like that, right? Right, so if I use this just to show where my pelvis is, then when I walk normally, my pelvis stays level. Right? But if gluteus medius and minimus are weak on one side and the other side drops, then you're going to see and by letting my foot drop, does that work? Did you see that? So that's gluteus medius and minimus being weak, possibly caused by damage to the superior gluteal nerve. Okay. So a little bit more detail about the gluteal muscles as a whole then. So if gluteus maximus is a powerful extensor of the hip, can you see how it's coming from the ilium, it's coming from the sacrum, it's coming from the lumbar fascia, and some of the deeper ligaments as well. Big muscle coming from all those points. It inserts into its own special gluteal tuberosity, but in fact most of it inserts into the connective tissue of the lower limb. So the lower limb is like covered in a fascia stocking, the fascia lata, but it's thickened laterally here, and this is the iliotibial tract, or the iliotibial band. Famously, runners tend to have problems with their iliotibial band. It gets tight because muscles pull on it because they run too much, and then it pulls on the knee and they get lateral knee pain. Stretch it, roll it on a foam roller, knee pain goes away. Ta-da, easy fix. So the gluteus maximus muscle sends a lot of its fibers into the fascia lata and into the iliotibial tract here. So as well as being a powerful extensor, it's also supporting the knee when it's extended. So as well as being a powerful extensor of the hip, it also supports the knee when it's extended, and some of its fibers can help with lateral rotation of the femur at the hip. And likewise, or conversely, gluteus medius and minimus can also get involved in medial rotation of the femur at the hip. Alright, so there are three gluteal muscles, and they're very important. Right, so that's hip abduction. What about hip adduction, bringing the leg back to the midline? That's these guys. All right, so if we have this anterior compartment here and posterior compartment here, we have a third compartment, a medial compartment. And the medial compartment of the thigh is filled with adductor muscles. And we've got, you know, big, short, long. So you've got adductor magnus, adductor brevis, adductor longus. We've also got gracilis. And these are all running from, you know, the pubic bone into the femur, pretty much. And these, again, are really large, really powerful muscles. They're all innervated by the obturator nerve. We can see the obturator nerve up here. Right? That's the obturator nerve. It runs within the rim or the brim of the bowl of the pelvis, so it kind of stands out as it runs around, and then it goes through the obturator foramen, which in life is covered by ligaments, goes through a little gap at the top of the obturator canal, and runs into the medial thigh. So the obturator nerve innervates all of these muscles of the medial compartment of the thigh. Easy, right? Femoral nerve, obturator nerve, sciatic nerve. So why are these adductor muscles so big? Essentially, it comes down to the same thing as the abductor muscles. This is a much bigger muscle mass than the abductor group, but as you're walking, you're constantly balancing. You're often on one leg. You're moving from leg to leg, and these muscles, you can feel it again. If you stand on one leg, these muscles are tense, right? Because they're helping balance the trunk over that one leg. So the hip adductors, this big adductor muscle group, is also important in stability and balance and gait and walking and running and all of that stuff. Okay? How's that? So those are the big muscles acting at the hip. We'll go deeper and look at the smaller muscles in the future. But we've looked at the hip flexors, the hip extensors, the hip abductors, and the hip adductors, and we've talked about their innervation. Okay. I hope that was helpful. I tried to keep it simple. There is a lot of detail in anatomy, but how much detail do you guys need to know? There's a lot of detail in the textbooks. If I try and get across the important points and get them to stick in your heads, then I think that's a worthwhile effort. All right, see you next time. I think I might nip out of work early. There was a geocache I didn't get last weekend and it's on the way home and it's a sunny day. I'll edit this video at home. I'll have a look, see if I can find that geocache on the way home. Maybe it'll be too busy, too muggly. Worth a go, innit?